Concern over the Omicron variant. Top health experts say it could be the most contagious form of COVID yet, and it's rapidly spreading across the country as cases and hospitalizations are on the rise, including in Texas and Louisiana. Joining us now to help break this down is Dr. Jim Versalovic, pathologist in chief at Texas Children's Hospital, and Dr. Robert Hart, chief medical officer at Ochsner Health System in Louisiana. Thank you both for joining us here on ABC News Live. First off, Dr. Hart, looking at where we are now in this fight against COVID-19, what are some of the things you're seeing there in Louisiana?
Well, we've actually been enjoying a nice downturn for a month since when we had our big spike earlier in the summer, coming out of the summer into the fall. So we've had some good months. Unfortunately, right now, we have just begun to see a little bit of an uptick in our positivity rates across the state. So we're watching that real carefully and closely because we do know that the Omicron variant is spreading across the U.S. and other areas. And so we're being very careful to watch that.
And Dr. Versalovic, what about for you there in Texas?
We're definitely seeing the Omicron variant begin to surge this week. Just in the past few days, we've seen a dramatic increase in cases among adults. Positivity has increased to the double digits in our neighboring hospitals here in the Texas Medical Center. And I should add, here at Texas Children's, just in the last 24 to 48 hours, we've seen effectively a doubling of our positivity, now approaching 7%, with nearly 100 new cases today alone. So it tells us that we are definitely in this beginning phase of a new surge or wave due to this new variant.
So Dr. Versalovic, if I could just follow up on that. The concern about this new wave is not that it would necessarily be as severe, right? The research is that it's less severe, that we have many of us vaccines, and now there's more medications and treatments, but that it could overwhelm hospitals. How concerned are you from what you can see and sense about this Omicron variant? The Texas hospitals, you know, are at risk right now.
Yeah, we've seen cases nearly triple just this week here in the Texas Medical Center. But I will add, we know what to do, and we want to reassure the public that this is very different than a year ago during the winter surge. First, we're just seeing a blip of influenza, but that's not a major factor. It's COVID again is the sole story. And we do have vaccines, and we have vaccines for children now, 5 to 12. We have boosters widely available. So it is a very different scenario, even compared to the Delta surge. I want to emphasize we still have plenty of Delta and Omicron. So this is a two-variant problem right now that we're facing. And we do need to stress the importance of vaccination and boosters. But the good news is they're widely available. The troubling sign from South Africa is that we are aware of increased pediatric hospitalizations, particularly in the youngest of children under 5 years of age. We've not seen that uptick yet. We've noted an uptick in adult hospitalizations just in the past few days here in Texas, but we'll have to follow this closely now among children in the coming days and weeks.
Well, as you said, a two-variant problem here. And Dr. Hart, there in Louisiana, I know today that state there reported over 1,000 new cases, and less than 50% of Louisiana residents are vaccinated. So the simple question here, is this about to get bad real fast here?
Well, that's our concern. You know, we're at now, I believe, 93 cases with the Omicron variant in the state. Our percentage of that strain is only 4.3, so we're not at the level that they're seeing over in the Texas Medical Center. But as you just heard, we know if you look at what's happened there, if you look at what's happened in the UK, those numbers can shift very quickly. And so with our vaccination rate as a state being as low as it is, we do have some populations that are very much at risk. And so we've enjoyed a nice, period of time when it's been down, but definitely on guard that this could bump up much quicker than we would like. The other problem that we see is not just to the point that was made. We are concerned that we may see hospitalizations, although there are reports coming out of the UK and some of the Israeli studies that hospitalizations aren't as frequent with this disease, with this particular variant. But if we see a lot of it, if the numbers go up dramatically, no doubt hospitalizations will rise a little bit. We know what to do, but we also have to do everything that we can to protect our staff. And so that's why it's so important to do the masking, to do the vaccinations that were just mentioned, and get those boosters. The boosters make a big difference, it appears, with the Omicron. So if there was a reason to get the booster, this Omicron variant ought to be convincing people the booster is the right thing to be getting right now.
Booster, and as you point out, Dr. Hart, the vaccine, the first and second shot for so many Americans. And so, Dr. Versalovic, data showing vaccines, are resistant. This particular variant, can degrade the effectiveness of the vaccine, or the vaccine isn't quite as effective against it. Explains why we're seeing so many positive cases of vaccinated individuals. And if I could just ask you to take a step back, we've put this issue and this whole pandemic through the grinder of our, politics and culture, where we're fighting with each other about so many issues. Do you think that this variant, which is going to hit us, it looks like wildfire, can help calm that and get us to focus on how we can best take care of each other and ourselves?
Exactly. I think this new variant is another opportunity to refocus, to prioritize as a nation and as a world. There's no doubt that we know what to do. It's about diagnosis through testing, treatment, and care. And we're doing an excellent job of that across the country. And new drugs and medications are available, but it's not just diagnosis and treatment. It's also about prevention through vaccination. And of course, through masking and other safe behaviors. I think we just need to continue to stay calm, be alert, knowing that we do know what we're wrestling with. But it is a new variant. It is highly transmissible. Vaccines may be less effective, but we want to emphasize, we know that even vaccinations without a booster will protect against this new variant and against hospitalizations, maybe not quite as well as Delta, but it's certainly an important shield. And then boosters, as Dr. Hart mentioned, we must continue to promote boosters for those that are beyond the 6-month period. And for children, we have plenty of work to do in terms of vaccinating children as well as adolescents.
All right, Dr. Jim Versalovic and Dr. Robert Hart, not only do we appreciate your time, we also appreciate the work you do in your respective communities. Thank you for joining us.
Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.